I would say the most important place that the digital AcuBlade can play in a crucial role is in management of the early stage laryngeal cancers, T1s, and premalignant disease, severe dysplasia, leukoplakia, carcinoma in situ. And there you can sculpt such a precise margin that you're actually leaving almost, differential layers of the lamina propria. Let alone, I mean, I'm not even talking about minimizing damage to the vocal ligament. You can literally see almost the layers of lamina propria and preserve some of the deeper layers to that. Yeah, obviously depending on the depth of the lesion that you're managing. And I think that represents a fundamental advance of this scanning robotic technology, is that you have a tool that will match your ability to see pathology under the microscope. And I think while the microspot and the micromanipulator are an important advance, it can't match what we see. And I think oftentimes the surgeon can see details but not have a precise enough tool to address that disease or to minimize trauma here. And the digital AcuBlade provides that kind of precise instrumentation.
In terms of the lines that are available through the AcuBlade, we see a significant decreased thermal signature with the use of the ultrapulse technology, which has helped, but also using the, not the lines, but the circles of ablation helps us, for lack of a better term, sand down lesions that are superficially on the vocal folds, whether that be leukoplakia or papilloma. Instead of defocusing the laser and having hot spots and cold spots, we have a very controlled method to remove these lesions superficially.
And so what we get then, in terms of advantages, well, obviously the number one advantage is precision. To me, the number two advantage is a reproducible laser tissue interaction that will give us then an ability to achieve expected outcomes with our patients. So in a world of evidence-based medicine, when we start talking now of being able to deliver expected laser tissue interactions of a certain length, a certain width, and a certain depth, and minimal collateral damage deep as well as laterally, we're talking then about being able to take these outcomes and moving them from Vanderbilt to any other place in the country.
It did something no other laser does, which is to say it controls the spot, the laser spot, for you, so that your spot is never in one place. The important part of that is that you are lasing, you are delivering that cutting energy to a very specific depth of tissue in one area without regards to your ability to smoothly move the joystick back and forth. This device increased my ability to smoothly cut through soft tissue so much that on my first contact with it, I immediately knew this was an absolute sea change in laser technology.
I have tended, though, now to start to use this in many of the other malignancies, the more advanced stage laryngeal cancers, the T2, the T3 glottic cancers, the supraglottic lesions, and the lateral pharyngeal lesions, because it's that ability to see layer by layer that allows you to anticipate even small blood vessels, understanding and appreciate the interface between tumor and normal is significantly enhanced, and it's faster as well because of the precision.
So the digital AcuBlade, for me, the biggest benefits that I see are the safety profile in terms of it produces a reproducible line or circle of ablation every time you use it due to the computer control. And the efficacy of that in terms of letting the residents operate or using it to preserve the superficial lamina propria because you know exactly what's going to happen. We never change some of the parameters so that we have a very good idea of what that tissue interaction is going to be in a certain location, because it gives us the same thing every time. And that is really an essential advantage of the AcuBlade. While there may be some other benefits of speed, that accuracy that comes through being able to reproducibly know how the energy is going to be delivered is something that I find essential.
There are many different types of cases in which the AcuBlade has a proven benefit over other modalities. Specifically, when the disease involves the epithelial layers of the larynx or trachea, then the AcuBlade can be used to generate a pattern to precisely ablate the diseased epithelium in a controlled, reliable manner. This allows us to treat entire regions of superficial papilloma by vaporizing one area with a predictable known depth and size of the area to be treated. This speeds the delivery of the laser energy and reduces the overall operative time so that we can treat extensive papilloma, we can excise vocal fold papillomatous lesions, we can excise laryngeal carcinomas, we can excise tracheal and supraglottic lesions as well. It's very useful for creating incisions in regions of tracheal or subglottic stenosis. Once the incisions are created, then the area can be treated with mitomycin C and dilated.
With my own hand, I cannot be as sharp and precise delivering the beam all along the incision line. So we did an histological study comparing with and without, and now with the parameters useful for phonosurgery, so benign focal fold lesions, the thickness of the thermal effect is no more than 15 to 25 micron. And if you remember before, it was more than 15. So at this time in the 80s, CO2 laser was under criticism because if you were not very careful, you could damage really the vocal folds. And it happened that the voice was worse after surgery than before, which is not the case. So I would say, thanks to the scanning system, you can perform your big surgeries faster, cancer surgery, arytenoidectomy. But now you can approach the phonosurgery in a very safe way. And even from some procedures like resection of a cyst, I feel better using my CO2 laser than cold instruments. So there's no point now, and any phonosurgeons using CO2 laser or cold surgery, they all admit now that you can perform a nice and proper surgery with the CO2 laser technology, provided that you use this robotic scanning system. I was told before that resecting a vocal fold cyst was just not possible. And no, I have, and I performed during my last course resection of a cyst using the CO2 laser with the AcuBlade. So this is an improvement. And beside this, yes, I was able to perform more careful resection in case of cancer surgery. Beside being an endoscopic surgeon, I perform a lot of surgery regarding the quality of voice, what we call phonosurgery. And I feel much better now than I was 10 or 15 years before.